Did you know, according to the American Heart Association, more than 100 million U.S. adults have high blood pressure? This silent killer is a major risk factor for heart disease, and half of those affected aren't even aware that they have it. Greetings, my name is Dr. Michelle Siegfried, family nurse practitioner. I'm the founder and CEO of Valley Case Management. VCM provides on-site medical services to several meta sites within the United States. As a nurse practitioner, I have treated many patients with hypertension and heart disease. With heart disease being the leading cause of death in women in the U.S., it's very important for each of us to pay attention to our blood pressure health. Recent research conducted by Cedars-Sinai found that blood pressure starts rising earlier and more rapidly in women. High blood pressure, also known as hypertension, develops when blood flows through the arteries at a higher than normal pressure. People of all ages and races can be affected. It's important to know the signs of high blood pressure and practice healthy habits to reduce the risks that could lead to hypertension. It can be especially easy for us as women to write off some early signs of hypertension. Signs like fatigue, bloating, headaches, blurred vision, dizziness, and chest pain or tightness are all possible signs of hypertension. Measuring your blood pressure regularly will identify any concerning trends. In addition to having your blood pressure checked by your healthcare professional during routine visits, you can also monitor it at home. Work closely with your medical provider to go over the step-by-step process for selecting and using your blood pressure monitor. Keep a log of all your measurements. This log will provide a reference point for blood pressure discussions between you and your medical provider. Take your blood pressure monitor with you to your appointment so that the readings can be validated. Let's talk about risk factors that increase your risk of hypertension. Factors that you cannot change include your family history, age, race, and gender. While we can't control these factors, we can control modifiable risks. These risks, which your action can impact, include diet, physical activity, alcohol and tobacco use, stress levels, and weight. So what can we do for ourselves to keep our blood pressure healthy and reduce the risk of hypertension? By introducing just a few hours of physical activity each week is not only beneficial for your heart, but also improves your mental health and can help reduce stress and anxiety. Chronic stress increases blood pressure and causes our body to store fat. Make sure you're taking time for self-care to manage stress and anxiety. Schedule things that are both good for you and important to you. Some ideas for self-care to incorporate into your daily routine include yoga, meditation, quiet time, or simply taking an outdoor walk. Eat a heart-healthy diet. Opt for naturally colorful food. Incorporate at least one fruit or vegetable to each meal. Also try substituting herbs for salt to achieve healthier meals that are just as tasty. Tobacco and alcohol consumption damage the heart, blood vessels, and other vital organs that can lead to high blood pressure in addition to other health complications. You can't always prevent high blood pressure, but you can control hypertension risk factors such as avoiding tobacco and limiting alcohol. All these measures can also lead to a healthier weight, which is a significant element of heart health. Reducing just 3 to 5% of one's body weight can improve blood pressure for the overweight. When it comes to our blood pressure health, the power is in our hands, and it starts with knowledge that leads to action. Know the signs, reduce the risks, and talk with your healthcare provider about what you can do to manage your blood pressure. Thank you for your time and attention. Happy Women in Construction Week. Be well.